Hi, my name is Mike Cheshire, and I've happened to have a brainstem injury from many, many years ago. At that particular time, I tried all kinds of things, trying to figure out what was wrong, how to get it fixed. I had tremendous headaches and blind spots in my eyes. When I start the migraine headaches, they always started in the same place, in this quadrant of my vision to the left-hand side, fill up all the way around and give me a bad headache. So, and trying to do things, finally my wife suggested some alternative medication type things, and she suggested I see Dr. Eric Tao, who was introduced to the United States by, as I understand it, from President Nixon when he started going back over to China and brought some people back. And Dr. Eric Tao helped me a lot. I didn't know that acupuncture would be anything that I would be able to use, but my body seems to really respond to it. And I know that when I first heard about it, I thought, punching needles in you, how's that going to help? And so, but I understand now that stimulation and all of the various types of stimulation that they do, how it helps. So after Dr. Tao retired, I guess basically I went away from acupuncture and tried to find something else. And then my wife mentioned Tammy, and so I started coming over to see Tammy. And about 2 years ago, I came in to see Tammy, and we went through about 4 or 5 sessions. It's amazing how quickly my body responds to that. And so I find myself in a position where I have these bad headaches, and it goes, I might last almost a year between headache sessions, meaning I have a headache 2 or 3 or 4 in a month, or maybe I go 2 months, and then I start getting to the point where I have to have acupuncture again. I go in and have the acupuncture done for maybe a month or 2, and then I can go almost another year before I have to have acupuncture done again. So one of the reasons for the acupuncture was the fact that I had a brainstem injury and a concussion. A broom fell 35 feet and hit me in the back of the skull. I'm a construction electrician. And it busted my head open and made me numb, and I couldn't feel my hands. And so everything that came from that precipitated all of my migraine headaches. And none of the medical doctors seemed to be able to do anything about it. And so I find myself in a position where the things I see, the things I feel as far as the actual response to acupuncture, my body seems to do real well. I'm back in to see Tammy again. It's been, like I say, over a year or so, and I've been doing fine, but past 2 months I've been having more headaches, and my wife says, hey, it's time to go see Tammy again. And so I came in and saw her on Monday. Today's Friday. I'm going to have a session today, and then I'm just going to set up for about a 4-month program of just for a month. This is going to be new to me, to have a month each, have one session each month. It'll be a little bit different for me, and see if that holds it off for a little bit longer. But I really do think Tammy does a good job, and I really appreciate the fact that she could get me in pretty much on whenever I need it, if I needed it mid-time or something like that, because she's very flexible for me. And that really is my story. Again, don't get hurt. Don't have a concussion, and don't do this is one of the best things I can tell you. But if you do, maybe your body will respond to acupuncture. Mine does, and I'm thankful for it, because when I'm going through them, it's not a fun time. I'm sick, laid up for a while, but when after I call myself getting myself punched after having the acupuncture, I feel really confident that I'm going to be better, and sure enough, I am. Well, thanks for listening.